Medical professionals looking with concern at the approaching flu season and the possibility of a dangerous new wave of COVID-19 cases. Those two things colliding at the same time. ABC's Trevor Ault has more.
When March came around, we had a lot of things take place that were not normal for us, were not normal for me. I was running around the facility, and then I was stopped, and I was told that the next one person came back positive, and then the second person came back positive, and now a staff member tested positive. And I just said, like, oh my God, this is real. This is happening to us.
I've been a nurse for many, many years, and I have never seen anything like that. I had on goggles, I had on mask, I had on face shield, I had on the gloves, and I went home and I felt extremely tired. I've never felt tiredness in my whole entire life like that.
And then we started seeing the new regulations from the Department of Health. We had to shut down visitation, we had to shut down group activities, we had to shut down group dining. Things that you can't explain to a resident.
That was very difficult, right? Because a lot of the time it was a lot of changes.
Yes, this is difficult. Yes, this is horrible. Yes, we're scared. Altogether, we're scared. But we're going to make the best of this.
I think that was the hardest part in the beginning, was that unknown who was going to get affected. We had to be very reactive. We consulted with the infectious disease people at one of our local hospitals, and they recommended 2 specific supplements that we put patients on at the nursing home, and we started on the upswing almost immediately after doing that protocol. It's like, oh my gosh, look at, they're so much better today than those patients were last week without this protocol. We're gaining on it, we're making a difference. And we have residents that have survived this, and they're stronger for it, and the buildings are stronger for it, and the staff is certainly stronger for it, so that if and when it does come again, we are more than ready, and we know for sure there's a light at the end of that tunnel, and that we're going to get through it if we have to go through it again. I had COVID myself. I was very sick. I was home for 2 weeks. My biggest fear was my grandchildren. My grandchildren are my life. I live for them. I have 2 fabulous boys that count on grandma to be funny and silly and to be there whenever they want to do anything. And then grandma gets COVID. I have at home, I have a huge wall-sized poster that they made me that says, "Grandma is the COVID slayer." And it shows grandma standing there with a big sword and a big word COVID, and the sword going through the word COVID.
We had to start acting fast. We had to start accommodating residents. We had to start accommodating family members.
I honestly believe that the Grand did their utmost best in handling this situation.
The day I was able to tell my staff that we were COVID-free was an incredible day. We were finally COVID-free. We would set up in the hallway with balloons, with signs. We'd give the residents a sign and say, "We beat COVID." And we'd march them down the hallway as they'd go home, and we'd clap for them. And there'd be dancing, and there'd be singing, there'd be music, and there'd be balloons. It was an incredible experience.
We had a parade at one building, and we had the fire engine, the police department, the ambulance crew, everybody coming through the parking lot to celebrate us being COVID-free.
We know that COVID's not gone. We know that there's a possibility that it comes back. But what I can say confidently is that we are more ready than we will ever be.
What would you say if somebody called you a hero?
I wouldn't really say that I was a hero. I would say that I am a nurse.
I don't see myself as a hero. I see my staff as heroes more than myself.
We don't look at it that way as healthcare workers. We look at it as this is our calling, and this is what we were here for. This is what we were put on this earth for, to be there for others, to protect the vulnerable, to protect the people that need us most.